Well, this morning we know more than 14,000 Hoosiers have been tested for COVID-19. Of those, around 2,500 have tested positive. But health leaders say the peak in Indiana should hit sometime between mid and late April, which is why health leaders are working on new ways to expand the testing now. There is some good news with that. The state health commissioner says Indiana is getting 15 of Abbott Labs' rapid results test machines. 13 Investigates reported on those earlier this week. The machines can get results in just minutes and not days like it does now. And we are seeing new efforts to make sure workers on the front lines have easy access to testing. Matt's live at the State Fairgrounds this morning, where drive-through testing starts today, but there are some limitations here, right, Matt?
Yeah, good morning to you, Julie. A pretty unique sight to see all these different orange cones all around me here. That's because this is one of the many different lines here for this drive-through testing for COVID-19 that begins today and really goes until next Saturday. But there are two big takeaways. First of all, this is open to a lot of people, but this is not open to the public. And secondly, you do have to register if you are planning to come out today. So information on your screen shows really who's in this essential category of the people who are allowed to come out here today and get tested. That includes emergency personnel, first responders and their families. That includes firefighters, police officers, ambulance workers, and medical staff. In addition to that, the other classifications include package delivery workers, Indigo bus drivers, for example, as well. Now, this will start today at 10 o'clock this morning, goes until 6 o'clock tonight. They are expecting a very large turnout for this drive-through testing. The actual process to get that swab is only expected to take a couple of minutes, however, and you can see by the long line of cones here, they do expect a large group here today. We've got more information for you on our website, WTHR.com. Ben?
All right, Matt, thanks so much. And hey, there are now is a new approach, I should say, this morning in potential treatments for the coronavirus. It turns out the secret could actually be in the blood of patients who had the virus but got better. In some areas like Colorado and Houston, doctors are experimenting with that blood and antibodies. Now there's a call for Indiana to do the same. On Tuesday, we asked the state's top health officer where Indiana was in testing for those antibodies.
To date, there's not a reliable way to check antibodies to determine if somebody has immunity to this.
Now, even if a test was available, it's not clear how long anyone would be immune to COVID-19 or if plasma therapy is an effective treatment, but some say it's worth seriously considering.
The director of the CDC warns that 25% of people infected with the new coronavirus may not show symptoms, and that changes the thinking about face masks. Let's connect the dots. Because of the lack of widespread testing, researchers don't know precisely how many people are infected without feeling sick, or if some of them just haven't shown any symptoms yet. But right now, they estimate it's about 1 in 4 cases. That high number could explain why COVID-19 is the first virus that is not an influenza virus to spark a global pandemic. That's because people may be spreading the contagious coronavirus without even realizing it. And that changes the thinking on masks. Basic face masks, not the N95 respirator, are designed to protect others from your germs. So even if you're feeling well but unknowingly carrying COVID-19, a face mask could offer some protection to people around you. A reminder that as we learn more about this coronavirus, it could change how we react to it.
So every morning, we're taking questions from viewers at home and trying our best to answer them here on Sunrise about COVID-19 and the stay-at-home order. So we got this question from Michael on Facebook asking, is there anything people can take or do besides washing their hands and staying at home to prevent getting the virus? And unfortunately, that's really the CDC guidelines at this point. So we know that it spreads from person-to-person contact. So stuff that you can do to protect yourself, again, wash your hands super often and avoid close contact. That's that social distancing that you keep hearing about. Staying home if you are sick and covering your coughs and your sneezes. So really similar to kind of what we've been saying and sort of the medical advice they give for cold and flu as well. Dave asking us on Facebook, what happens with organ donations from those that die of COVID-19? And Dave, this was a tricky question. So from kidney.org, the National Registration for Kidney Donations, they have this frequently asked question that says, are those who pass due to COVID-19 eligible organ donors? And it says the risk of transmitting disease through solid organ transplantation is not known at this time. Head to the CDC for more information. When you head to the CDC website, though, they don't have a ton of information about COVID-19 and organ transplantation. So now we know if you're a living donor, what they're asking, if you're going to give a kidney, that's something you've been planning to do and you have a match, they're asking that you avoid those hotspot areas, and that if you do have symptoms of COVID-19, they're going to ask you to quarantine for 14 to 28 days. So not a super clear answer for what's happening with people who pass if they were on the organ donation registry. We're going to keep looking into that, though. And as always, if you have questions, please reach out to us using the hashtag 13sunrise.
Thanks a lot, Meredith. Hey, it is 5:08, and let's take a look at your morning rush. We know it feels like the coronavirus updates come in hourly, so here's the three big stories to know about today. The Indianapolis FOP is taking care of first responders on the front lines. They're launching a new program called Food Stops for Cops. At the start of each shift, IMPD officers get fed safely with social distancing through a food truck. It's meant to support local businesses and show officers they're valued. Next, two brothers are working together to make sure healthcare providers and first responders have masks to protect their faces. They're using 3D printers to do it. Bruce Merrill and his brother Brad started 3D printed products 3 years ago. They're printing parts used to make more than 100 protective face shields. Finally, we have an update on Zubilation. I know a lot of you have been wondering about this. So it is still scheduled for June 12th as of now. But the Indianapolis Zoo does have a backup date. It's August 14th in case it needs to be moved. The zoo tells us they'll make the decision in early May, so about another month or so. Zubilation is the zoo's biggest fundraiser. And Chuck, I think it's events like Zubilation and Rev that we're all looking forward to eventually just getting back out to.